Proton pump inhibitors, PPIs, are a favored treatment for acid-related disorders, such as GERD and erosive esophagitis, because, unlike antacids and histamine blockers, PPIs act directly on the source of acid production, the proton pump. However, until now, all oral PPIs have been delayed-release formulations requiring an enteric coating. For many patients, immediate-release Zegerid may represent an important new option. On close inspection, it becomes apparent that acid production is a complex and well-orchestrated process. As we scan across the internal surface of the stomach, the glands that produce gastric juice are visible as small pits in the mucosa. Each of these glands contains specialized cells that secrete hydrochloric acid, HCl, digestive enzymes, hormones, and other products. We see here parietal cells secreting large quantities of HCl. Note the distinctive conical structure. A low pH environment is rapidly formed on the luminal side of the parietal cell as hydrochloric acid flows outward. The parietal cell is designed for rapid activation when stimulated and is deactivated through feedback inhibition when the stimulus wanes. As we move into the main exit channel of the parietal cell, the secretory canaliculus, we see that the surface is covered with enzymes called proton pumps. When the cell is stimulated, proton pumps migrate from the cytoplasm and take position in the secretory membrane. The pumps become activated and begin the ion exchange process that produces hydrochloric acid. Here, we see the H+K+ ATPase ion exchanger or proton pump in greater detail. The pump transports protons out of the cell and into the space of the canaliculus in exchange for potassium ions. Each proton secreted spontaneously combines with a chloride ion to form hydrochloric acid. The proton pump is the final common pathway for acid production. For this reason, therapeutic agents that block pump activity, called proton pump inhibitors, or PPIs, are highly effective at controlling excess gastric acid production. One consideration with oral delayed-release PPIs, such as omeprazole, is the necessity for protection from stomach acid that would otherwise degrade the drug before it can be absorbed. A protective enteric coating is employed to keep delayed-release PPIs intact as they pass through the acid environment of the stomach, but in doing so, the coating delays absorption and bioavailability. In spite of this, all delayed-release PPIs have a rapid effect on acid production once absorbed. Here, we see the omeprazole molecule binding to a proton pump and stopping its operation. Note that PPIs are only effective against activated proton pumps. Until recently, all oral delayed-release PPIs have been enteric coated. Now, there is Zegerid, the first and only immediate-release oral PPI. Zegerid is a novel PPI formulation that integrates an antacid buffer in a liquid suspension to protect omeprazole from acid degradation. With no enteric coating to delay absorption, Zegerid achieves peak plasma levels in approximately 30 minutes. And once daily Zegerid sustains strong acid suppression throughout the day. Zegerid, the first and only immediate-release oral PPI. Peak plasma levels in approximately 30 minutes, 24-hour acid control, convenient, easy to use once daily formulation. Zegerid is indicated for short-term treatment of active duodenal ulcer, for heartburn and other symptoms associated with gastroesophageal reflux disease, GERD, for the short-term treatment 4 to 8 weeks of erosive esophagitis, which has been diagnosed by endoscopy, and for maintenance of healing of erosive esophagitis. Controlled studies do not extend beyond 12 months. The most frequently reported adverse events with Zegerid are headache, diarrhea, and abdominal pain. Symptomatic response to therapy does not preclude presence of gastric malignancy. Atropic gastritis has been noted occasionally in gastric corpus biopsies from patients treated long-term with omeprazole. Zegerid contains 460 milligrams sodium per dose in the form of sodium bicarbonate, which should be taken into consideration for patients on a sodium-restricted diet. Zegerid contains 1,680 milligrams or 20 milliequivalents of sodium bicarbonate. Sodium bicarbonate is contraindicated in patients with metabolic alkalosis and hypocalcemia. Please see a Santarus sales representative for full prescribing information.